When love sees no color, should skin decide a soulmate? Hi, I'm Dr. Jyoti Gupta, consultant dermatologist, and today I'd like to discuss a very sensitive topic, which is vitiligo and marriage. First of all, for those who don't know, vitiligo is also known as leukoderma oculory or white spot disease, and it is seen in almost 0.5 to 2% of the Indian population. It can spread through almost all body parts. A few things I really want to convey here are it cannot spread from one person to another. So it is not a contagious disease, contrary to what many people believe. It is also associated with an autoimmune phenomena where your immune cells start attacking your pigment cells or the melanin producing cells. It can be linked to certain conditions like thyroid disorders, diabetes, or bowel disorder, which are already quite common in Indian population. It has been seen that 10% of individuals with vitiligo will have one close relative who also has vitiligo. So genetically speaking, yes, 10% will have a genetic history. I see a lot of patients and their prospective in-laws coming in with bride or groom. In my experience, I have mostly seen prospective brides being brought in by their parents and future in-laws with different type of concerns. First of all, let me clarify: the incidence of vitiligo in males and females is the same genetically. I believe that one should not discriminate against someone with vitiligo, but one should also know the facts so they can take an informed decision if they're planning to bring a new member into their family. Let me give you some examples. I clearly remember one of my patients whose father has vitiligo. The future in-laws brought the prospective bride and her parents to ask whether she could develop it, even though she didn't have any signs at that time. Now, many people may inherit the gene and never develop vitiligo. So it's not necessary that if you don't have it now, you won't carry the gene. However, there is no definite yes or no. You might carry the gene and never develop the disease. That should be very clear. Also, the idea that vitiligo skips a generation is a myth. Just because your father has it doesn't mean you won't have it, and only your children might. Vitiligo can occur in any generation depending on genetic expression. Another patient came in after I had performed surgery for vitiligo, and the result was completely flawless. But the prospective spouse and their family were still worried. Can it come back? At that time, there was no visible lesion. So, what are the future implications for the individual or their children? Firstly, I would like to say that yes, even after surgery or treatment, there is no guarantee that vitiligo won't recur, but one should also understand that vitiligo is treatable and manageable. One should not be scared about developing it in later stages of life. Secondly, can it worsen at some point? Yes, with stressful life events, infections, or even with sunburns, the condition can flare up. Sunburn especially can worsen it. During pregnancy, especially in females, it has been seen that 20% may experience worsening, 15% may actually improve, and the others may have no change at all due to changes in the immunity. Now, can it happen to your children if you have vitiligo? Is there an increased risk? The normal incidence is 0.5 to 2%. This can increase from 5 to 8% depending on how many first degree relatives are affected. First degree means your parents, your brother or sisters, or your children. If both parents are affected, the chances can go up to 8%. In identical twins also, if one is affected, the other has a 23% risk. But still, 77% will not have the disease, even with the same genes. And 95% of the children with affected parents will not develop vitiligo. So, in a nutshell, vitiligo is not contagious. It can worsen after marriage due to stress, but a healthy, supportive environment can help prevent flare ups. Now, I personally feel, and this is my personal opinion, not a medical one, that whether it's the groom or bride, they should not hide the fact that a relative has vitiligo. You should be completely honest about it. We live in times when people break off relationships for very small reason, and hiding such an important detail, thinking it might pass, is wrong in my opinion. There's a large section of people who will accept you, not judge you based on your skin or vitiligo status. But if you try to hide it, that means you also think that it is a problem. And this can damage the foundation of trust in a marriage. I also believe that sometimes like minded individuals or couples who both understand such skin conditions can form stronger bonds. I was impressed with the site called Derma Matrimony, where they focus on connecting people with vitiligo or similar skin conditions, so they can focus on other aspects of life instead of being held by one condition. So that's a great initiative. But beyond that, I would say we don't judge a person for having thyroid, diabetes, or any other disease. So why to judge someone for having vitiligo?